A huge hurdle is breaking the stigma, letting kids know they're not broken, just hurt. And like physical injuries, they need treatment. That's why more and more schools are opting into the TRAILS program, an evidence-based mental health service. Bright Pine Behavioral Health was established in 2017. Dr. Kat Lewitsky opened a second location this year. She says it was to keep up with demand.
You know, right now it's just so difficult for everyone just to get in anywhere, but we're trying to work as quickly as we can to get everybody in.
Lewitsky says it's a product of a major shift in life as we know it. The onset of the pandemic robbed children of social interactions, routine, and in some cases, major milestones. Stacey Newar's heart still breaks for her daughter.
She didn't even get one of those like drive-by birthdays, right? So she didn't even really get a birthday party that year. That's the hardest part for me, and just like knowing like how pervasive it is.
A universal health screening showed Detroit public school administrators just how bad the crisis really is. During the 2021 school year, approximately half of K-5 kids reported mental health struggles. At least 40% lost a loved one.
Those are little people. Those are 5-year-olds, basically up to about 10 years old. Half of them expressed that they felt sad, mad, worried, or anxious.
Deputy Superintendent Alicia Merriweather is a longtime educator, and so is her dad. He passed, but his passion for supporting students still brings tears to her eyes.
In every single school, there are people who have dedicated their lives to take care of our kids. Sorry.
She says all of Detroit's K-8 schools have a clinician and a 3-tier approach. Each tier provides a level of support, with 3 being the most intense. Kids under 14 need permission to get the more comprehensive services.
The additional service that we have it across the schools, but if the parent doesn't sign the consent, we cannot offer the services. It's illegal.
Merriweather says a lot of these services are funded by COVID relief dollars. Whether that money will be provided next year is still up in the air.
When you have behavioral health issues, you either are going to allocate the funding necessary or you're not. Either way, there's a consequence.
Parents can do their part too. Experts say have your kids spend more time outside and less time on their phones, and more importantly, keep your own mental health in check.
If you are not able to help yourself, if you're not in a good place, you're not going to be in a good place to help your child.
I'm Alex Bozargian for 7 Action News.